Good morning. My name is Manpreet Kaur Pawar and my student ID is 385100, and the topic that I have chosen for my diagnostic video presentation is pulse oximetry. Introduction. Pulse oximetry is the common diagnostic test which is used in the hospital in order to assess the patient's oxygen level in the blood. There are patients who come to the hospitals and showing signs of a low oxygen and their body is turning into blue. So it is very important to assess their oxygen level with the help of the pulse oximetry test, and so that doctor can continue to their medications. Purpose of the pulse oximetry test is it is the common, simple, and the painless diagnostic test which is used to measure the oxygen level plus the how well the heart is pumping oxygen throughout the body. How does the test works? So in the pulse oximetry test, a pulse oximetry, which is a small clamp-like device, is placed over the finger toe, earlobe or toe, and then a ray of light is passed to your blood, and which will show the oxygen saturation level in your body. And it also will show that whether your blood is oxygenated or deoxygenated. Then is that how long this procedure takes place. It is very simple procedure which takes about 1 to 2 minutes. Just a small clamp like device is placed over your finger toe, and it will show the readings of your oxygen level in your body. Then is that which department need to be in contact in order to order this pulse oximetry test. As the patients come to the hospital, which sometimes they are having they are having difficulty in breathing, and their body shows the signs of blue, that their body is turning into blue, so which indicates that they are not they're having difficulty in inhaling the oxygen. So it is important to contact the respiratory department so that they can order that the patient need to have a pulse oximetry test, so that they can analyze that how much oxygen is present in the patient's body, and then the further treatment can be started. Then is that other secondary tasks that as a HUC you have to perform in order for the pulse oximetry test is, first of all, you are the first person. Being a HUC, you are the first person that the patient will be in contact. So you have to prepare the client. You have to explain the whole procedure to the patient in order to calm down and reduce their anxiety, as the patient is coming to the hospital and it is a very overwhelming experience. So you need to calm down the patient and explain all the procedure to them. Then you have to prepare them for the test. Thirdly is that you have to send the requisition form to the respiratory department that you need to order the pulse oximetry device. Last but not least, you have to inform your charge nurse. Then is that other departments that need to be in contact for the pulse oximetry test is the respiratory department only, because as they are concerned with the respiratory problems, as the patient would be having difficulty in breathing. So it's the respiratory department that has to be contact in order to in order to place the order. Then conclusion. Pulse oximetry test is very common and simple and painless diagnostic test which is used in the hospitals, and it is the very common test which will help the doctor to analyze that their patient is oxygen, how much is the oxygen level in the patient's blood, and then they can continue their treatment and medications. And also it is usually seen in ICUs and other units to monitor the ongoing condition of the patient. Thank you.